Number one is arthritis is always the blame. The cause of persistent knee pain is always the same, and arthritis is always to blame. Now, obviously, you can say that's probably not true. Yes, I've heard of ACL injuries and I've heard of meniscus injuries, but majority of people, when they get to age 50 plus, their doctor says you have arthritis, and that's the blame for knee pain, right? Well, the interesting thing about this is that arthritis is something that can be managed, okay? So minor to moderate arthritis actually has poor correlation to pain levels, right? So they did research, and what they did is they actually took radiographics, so x-rays of people's knees, and they measured how much arthritis, right? You can see the increased white spots in between the two joint surfaces, which is indicative of osteoarthritis. So we're talking about, when I say arthritis, I'm talking about osteoarthritis. I'm not talking about rheumatoid arthritis or giant cell arthritis or anything like that. We're talking about osteoarthritis. So it's most common, most typical. Minor to moderate arthritis has a poor correlation to pain, okay? So a lot of people with very little pain or no pain at all, if you x-ray their knees, can show moderate arthritis. So a lot of people assume that, well, if arthritis shows up on an x-ray, I need to have a knee replacement. However, there's lots of people that are living with arthritis that don't have pain or have very little pain. So that's our first clue that there's something else. It's not just arthritis, right? So we run across this all the time where we have people that were told by their doctor that they need a knee replacement because they have bone-on-bone arthritis, right? This is not true. He really didn't want to go through surgery, so they ended up coming to us, and he was able to get back to golfing and doing the things that he wanted to do without having his knee replaced. So motion is lotion. The research shows that with proper form, regular activity, not intense activity, but moderate activity actually decreases pain when it comes to arthritis, right? So the hard part is it ends up kind of hurting to get going, but once you get going, it starts to loosen up. Motion is lotion, right? And so finding ways to reduce the stress on your knee and keep the wear and tear from accelerating, but you gotta keep moving. And a lot of people feel like pain is danger and I need to stop doing whatever I'm doing. If you have moderate to severe arthritis, there's some people that we tell them we're not gonna get rid of your knee pain. But if we can keep it at a 2 or a 3 out of 10, and you can still do all the things that you want to be able to do, well, then that's better than it sitting at a 7 or 8 and you contemplating doing knee replacement. So there's lots of other structures that can be the culprit. You can have meniscus injuries, you can have ligaments, you can have tendons, you can actually have the muscles themselves be sources of pain. You can even, I had a gentleman just the other week that came into our clinic saying that he had the worst knee pain, and his doctors say they don't know what to do because his knee doesn't have any arthritis, and the MRI came up completely clear. After we did an evaluation, we found out that it was actually his back that was causing the pain, and he had nerve referral pain in his knee, right? So it's not always cut and dry. Some doctors can wean that out and they'll send you to the right place, but some primary care doctors and even some orthopedic doctors, they're just too much in a hurry. They don't get enough time with you to be able to actually evaluate, to get an accurate diagnosis. So why do people continue to have knee pain longer than they should, right? So first off, a lot of people never start doing anything. They're just complacent. It's part of life. I get old, I get pain, I just deal with it. I'll stop playing tennis, I'll stop playing golf, I'll stop traveling, I'll just kind of give in, right? So that's one reason why. Other people give up too soon. I've tried therapy or tried to exercise. I went to the gym for a couple months and then I stopped. Well, this is an ongoing thing. If you're ready to make a lifestyle change, if you want to make sure you're doing things right, then you can't give up, right? If you want to live an active lifestyle where you travel the world, where you play golf, well, you play tennis, then you can't give up. You have to continue to keep your body in shape so that you can be active. Not performing the right type of exercises. I'll hear people say, I walk every day. My knee should be great. Well, walking is walking. There are ways to walk with poor mechanics, and it doesn't necessarily hit all the exercises that you need. I'm getting a couple messages. Okay, those were a long time ago. All right. So a lot of people don't perform the messages or the exercises in the right way, causing actually more wear and tear on their knees. Not working with experts who specialize in working with older adults, right? I hear this all the time. I work out with my personal trainer. He does a great job, and I would never stop going to him. He just keeps, he's so great, or she's so great. And I say, well, how's your knee pain? It's terrible. Oh, how are they addressing your knee pain? Oh yeah, we do a lot of exercises to get my legs strong. Good. Are they getting stronger? Yeah. Oh, how's your knee pain? It's terrible. Okay, well you're missing something, right? And it takes a different lens of expertise to work with older adults. We have a lot more things going on, right? It's just more complicated. And sadly enough, there are really good personal trainers out there, don't get me wrong, but they do not have a doctorate level education behind why they're doing what they're doing, right? There's no governing body over personal trainers. You can take a weekend course and become a personal trainer. We went to school for 7 years to become a doctor of physical therapy. So a lot of people just have a new injury, right? They're doing great, and then they have a little flare up, and it just kind of derails them, and they get discouraged, and they stop, and they give up. Lack of accountability. They don't have someone to say, hey, come on, let's go. We're doing your exercises today. So whether you have a workout party, a buddy, if you have a personal trainer, after you've worked with a physical therapist, or if you have one of our wellness programs or things that we do to help people stay accountable once their knee pain goes away. And a lot of people just wait till it's too late. If someone's knee arthritis is really, really bad, like you said, there's some people that just aren't going to come back from that. They're going to need knee replacement. And even after that, it's an uphill battle. So don't wait till it's too late. Do something that you can do about it. So one thing I wanted to talk about when we talk about doing the right type of exercise, a lot of people, and even a lot of reputable therapy clinics and chiropractic clinics, they get tunnel vision and they just look at the knee joint. Let me do exercises for the knee. Let me do massage on the knee. Let me do treatments to the knee, right? However, the knee, a lot of times is just the culprit between two other joints, right? So I'm not really in a setup that I can show you, but if you can picture this, if I do a squat, my knees are meant to bend like a hinge on a door, right? However, your knees can come in together or they can splay out to the side. When they come together, they're not bending in a straight hinge position. It's putting torque on the knee. And a lot of times that's because of your weakness or awareness in your hips. Most of the time, as Americans, we sit too much. We're not that active. We don't do a lot of side-to-side activity. Our butt muscles get very weak, which then causes us to have poor mechanics during squatting or walking or exercises. The other thing is your feet. A lot of people have weak ankles and weak arches and have issues with maintaining their feet, your foundation, in the right position, which then causes extra twisting at the knee joint. And every time your knees, or every time your feet collapse in, your knees follow, right? And it takes them out of that normal hinge position and puts too much stress on the knee. So those are the things that we do differently than some of the stereotypical, let me just massage your knee, let me just give you squats, let me just make sure your quads are real strong. Yes, getting your quads strong is really important, but if you're missing really big pieces of the puzzle, then you're just going to spin your wheels. So hopefully that helped. So what are some options of working with natural fit therapy? So I told everyone that we would talk about what it would look like to work with natural fit therapy. We have one-on-one treatments supervised by a doctor of physical therapy. This is what you would consider traditional physical therapy. However, we're one-on-one the whole time. And so you're working with your therapist. They're making sure you do the exercises right. They're doing hands-on work to make sure the range of motion is good in your knee. We're making sure all the mechanics work well, right? That's where most people end up starting. We also have one-on-one wellness and personal training. So once people get out of knee pain and their knees start feeling great, we noticed when I first started natural fit therapy, I was like, I'm going to get everyone better. I'm going to save the world, right? And people would come to me and they'd start getting better, 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 better. I discharge them with the best exercises that they can ever do. And slowly they start going downhill. And I would see them in my office 6 months, a year later. I said, what is missing here? And I realized people get derailed. They don't do their exercises. Life gets in the way. They start doing the exercises wrong. Sometimes they'll come in and be like, I've been doing all the exercises. Watch, let me show you. And I'm like, where did you learn that? I did not teach you that. And they're not doing things right. So a lot of people will continue with our personal training, or if they're really not that bad off and they just want to prevent knee pain, they can start at one of our personal training options. We also have a group virtual wellness membership. This is great for people to bring the cost of treatment down. We do group classes right over Zoom. We do 4 a week, one that specifically works on balance, one that specifically works on strengthening, especially for the knee joints. And then we have one that works on stretching to make sure we're mobile. And then one that's a little higher pace that's good for cardio to keep your heart healthy. So a lot of people don't start there, but I just wanted everyone to be aware of what options are available. But where most people start that are new to natural fit therapy is they start with a discovery session. And a discovery session is for someone who thinks we might be able to help, but are still nervous and skeptical, and they're not really sure what to do next. So like I said, I was going to give everyone an option to be able to get one of these free discovery visits. So we have 2 options. We have a virtual option and an in-person, okay? And this is for someone, like I said, who thinks we might be able to help. They've heard some of the strategies and techniques that we've talked about today, and they said, you know what, I'm curious. I'm not sure, but I would like to talk one-on-one about my specific situation, right? And so if you go to the link there, and Victoria will drop it in the chat here shortly. Hopefully she's still with us. And all you have to do is enter your information in there, and then it will alert us that you're interested in one of these discovery sessions, okay? Now, the cool thing is if you book today, then you will actually be eligible for a free month of our virtual group wellness membership, which is a $100 value. Okay, now this is something that you most likely will use in the future, but we know that a lot of people will be on the workshop today and they'll say, that's me, I need to do something about it. I'll do it tomorrow though. And tomorrow rolls around and the dog makes a mess, or your wife asks you to do a new project around the house, or the grandkids come over for a visit, and then it's out the door and you forget about it, right? And so we want to give everyone a little bit of incentive, because we know human nature, we know how people are like, we know how to get the most out of people. And so we're going to give away a free month of that membership just to come and do a free consultation, right? So go ahead and click that. It's naturalfittherapy.com/kneepaindv. That's DV for discovery visit. If you don't want to mess with that, you are welcome to go ahead and call our clinic. Our phones will be switching off in the next 10 minutes. So just leave a message, say I want my free discovery session and I want to make sure I get my free bonus. They will call you back tomorrow and talk to you about that.